Joren Rives leaned against the cool hull of the medical pod, staring at the ceiling of the alien infirmary. His left arm throbbed with a pain that pulsed in time with his heartbeat, and despite the numbing injection, the ache never fully left. His uniform was torn at the shoulder where the pressure seal had failed, and the skin beneath was a mess of blood, gauze, and bruises. The last hour had been a blur of shouting, flashing lights, and the distinct sound of metal tearing apart under stress. "Stay still," said the tall, green-skinned medic hovering beside him. His name was Dralon, and he had not stopped scanning Joren since they'd dragged the human into the infirmary. "You have a compound fracture in the humerus. You're lucky the bone didn't sever an artery." "I wasn't trying to win a prize," Joren muttered through gritted teeth. Dralon's 3 eyes narrowed slightly. "Do not joke, this is a serious injury." Joren didn't reply. His eyelids drooped for a second, then fluttered open again when a sharp pain lanced down his arm. He cursed under his breath. The infirmary was far cleaner and more advanced than anything Joren had trained in on Earth. The walls shimmered faintly, adjusting their hue depending on the patient's condition. Monitors embedded in the floor panels tracked every movement, but the tools were alien literally, and none of them seemed designed with human physiology in mind. Dralon stepped back, tapped something on a floating panel, and frowned. "Your biology continues to confuse me. The inflammation is spreading faster than expected. I must assume microbial contamination from your own skin flora. We need to administer antimicrobials." "Check the medkit," Joren said, nodding to the small black case clipped to his belt. "Front pocket, there should be a bottle of broad-spectrum antibiotics." Dralon turned to the kit, unfastened it, and pulled out a small cylindrical container. He rotated it in his long fingers, then opened it and tipped a single white pill into his palm. He stared at it. "This is medicine?" "Yeah, amoxicillin, basic stuff. It is so small." "Well, it's not the size that matters," Joren said, shifting with a grimace. "It's how it works." Dralon moved to a console and hovered the pill under a scanner. The screen lit up with a molecular diagram, and Joren watched as the alien's expression changed from curiosity to genuine astonishment. "This compound targets bacterial cell walls without harming host cells. That's the idea." Dralon turned to another medic, a smaller, blue-skinned figure named Valen, and held up the pill. "This is denser in function than our entire pathogen suppression protocol." Valen peered at the scan, then looked at Joren. "You carry these routinely. Standard issue. You think that's impressive? You should see our antifungals." The 2 alien medics exchanged a look, then moved quickly to replicate the antibiotic in their system. Within minutes, they had synthesized a compatible version and administered it intravenously to Joren. The relief was not instant, but within half an hour, the swelling in his arm had begun to recede. Dralon returned to his side with a strange expression. "Our own treatments rely heavily on immune modulation and aggressive nanocyte therapy. We overlooked the simplicity of direct microbial inhibition." "Sometimes simple works," Joren said, exhaling. "We've been doing this a long time." "You weaponized molecules," Dralon said, almost to himself. "You created microscopic precision tools from fermentation byproducts," Valen added, "and you stored them in a belt pouch." Joren chuckled, which made his shoulder hurt again. "Gotta be prepared." Later that day, the infirmary filled with more alien beings, some medical, some scientific, and a few that Joren suspected were just curious onlookers. Word had spread quickly. Dralon presented the pill again, laid out on a sterile field like a sacred artifact. He explained its chemical structure, mode of action, and efficacy to an audience that grew increasingly animated. One of the observers, a tall, silver-skinned female named Sirach, leaned toward Joren. "We've spent decades trying to contain a respiratory pathogen on Thalos Prime. Your pill might cure it." "That's not a guarantee," Joren said. "You'd need to test for compatibility, resistance, side effects. We've already started," she interrupted briskly. Valen is adapting the compound to Thalosian physiology right now. Joren blinked. You work fast. We have to. That outbreak has already claimed over 30,000. By the next day, Joren's arm had been stabilized in a temporary cast. The break was clean but had shifted, so Dralin scheduled a surgical realignment for the following morning. Joren didn't argue. He was exhausted and still running a slight fever, but at least he wasn't septic. When Dralin returned that evening, he brought a tablet with several recorded messages. Each one was from a different world, each expressing gratitude and disbelief. Most were short, simple statements of thanks, but a few went further. "You have no idea what this means to us," said one, a pale, luminous-eyed being who identified herself as Mela from the planet Nuvrax. "We thought the fever plague was incurable. Your medicine stopped it in one dose." Joren shook his head. "That's not possible. It's not even designed for alien biology. Apparently, our pathogens are similar enough. Or perhaps your medicine is more adaptable than you realize." By the time the surgery began, Joren was under heavy sedation. Dralin worked carefully, guided by scans and assisted by Valen. The bones were realigned, fastened with a biocompatible splint, and sealed in a regenerating cast. Recovery would take weeks. No shortcuts. Joren spent most of the first week in bed, his arm immobilized, his body fatigued. Visitors came daily, some medical, some diplomatic. Each brought more questions. "How many strains of antibiotics do you carry at once? What is the mechanism behind resistance? Do you synthesize these yourself or rely on cultivation? Why are they all shaped like that?" Joren answered what he could. Sometimes he simply didn't know. He wasn't a pharmacist. He was trained to use what he was given. One day, Valen returned with a tray of pills, each one modeled on a different human antibiotic. "We've begun producing them in limited quantities," he said. "Your designs are elegant, efficient. We've had to adjust the delivery method for certain species, but the chemistry holds." "You're not giving them out already, are you?" "No, only for testing, but early results are promising." Joren sighed. "Just be careful, overuse leads to resistance." "You don't want to turn these things into superbugs." Dralin nodded. "We're documenting everything. Your caution is noted." By the time Joren could walk again without assistance, the infirmary had changed. The walls were lined with new equipment, hybrid systems blending human and alien technology. The medkit he'd carried now sat in a transparent case, labeled and cataloged. The pill bottle was gone, replaced with a digital archive of its contents. One afternoon, during physical therapy, Sirach returned. "We've begun distribution of the adapted compound on Thalos Prime," she said. "Injections only for now, but mortality has dropped by 80%. Joren let out a breath. "That's good news. You're responsible for saving thousands." "No, the people who made those pills did that. I just had them in my kit." She tilted her head. Modest, honest. As the weeks passed, Joren's strength returned. He still had limited range of motion in his shoulder, and Dralin insisted on daily exercises. But the fever was gone, the infection under control, and the fracture was healing. On his last day in the infirmary, just before discharge, Dralin handed him a new medkit. It was sleeker, heavier, and embossed with a symbol Joren didn't recognize. "What's this?" "A redesigned kit," Dralin said, "based on your model. It contains human antibiotics, adjusted for multi-species compatibility, and a translated guide for use. With your permission, we'd like to standardize it for interstellar missions." Joren opened the kit. Inside were white pills, red capsules, and a small digital screen with instructions in several languages. "Well," he said, "guess we're not so backward after all." Dralin looked at him. "Your people have survived a hostile planet for millennia. We are only beginning to understand how." Joren closed the kit and nodded. "Just make sure you don't hand those out like candy." "Understood." As he walked out of the infirmary, arm still bound, steps still cautious, Joren saw the corridor ahead filled with alien medics, scientists, and officers. They watched him pass, not with awe, but with a quiet respect. All because of a little white pill. The orchid-colored sky outside the infirmary dome was just beginning to dim when Joren stepped out for the first time in nearly 2 weeks. The artificial gravity still felt slightly off, and his arm was supported by a carbon mesh sling that wrapped diagonally across his torso, but he walked without help. Not far, not fast, but upright and unaided. He'd expected to be escorted back to his quarters quietly. Instead, there was a line of 6 aliens waiting near the corridor junction, all wearing the same muted gray uniforms with a pale blue insignia stitched at the collar. The Diplomatic Science Corps. Each bore a different physiology. One had no visible mouth. Another blinked horizontally, and every one of them looked at Joren like he was carrying a meteorite in his pocket. The tallest, with a neck that swayed slightly even at rest, approached first. "Joren Rives," it said, voice low and oddly melodic. "I am Eltrin of the Dari Compact. May we request a moment of your advisement?" Joren blinked. "I'm not cleared for diplomatic debriefs." "I'm just You are the first human to demonstrate cross-species pharmacological efficacy with unmodified biotics." He glanced at the others. They were watching him with too much intensity for comfort. "Right, okay, but I'm still recovering." "Can this wait until tomorrow?" Eltrin extended an arm, not a hand, just a smooth, tapering limb ending in what looked like a leaf. "We have already prepared an observation chamber. We were informed humans prefer soft seating and warm lighting." Joren sighed. "You got snacks." "Many." An hour later, he was sitting on what resembled a deeply padded dentist's chair, its contours adapting to his body each time he shifted. The room was circular and softly lit from below, casting a mild orange hue upward that made everyone look like they were telling ghost stories. A shallow table had been filled with various items, some food adjacent, some clearly not. Joren picked up a translucent cube that vibrated slightly. Eltrin watched. "That is a nutrient solid. It contains protein, carbohydrate, and a mild stimulant." Joren sniffed it. "Why's it humming?" "It's excited." He put it down. Across from him sat a being made entirely of interlocking plates, like someone had assembled a beetle from car parts. It introduced itself as Joren and asked without preamble, "How do you determine the correct dosage of antibiotic for a species you've never encountered?" "We don't," Joren said. "We test it. Carefully. 1 dose, low end, monitor vitals, labs, symptoms. If nothing explodes, you go from there." Another alien, this one a thin, radiant figure with no visible facial features and a voice like a wind chime, leaned forward. "But your species has over 8 billion individuals. You cannot test each one." "No," Joren said. "So we use statistics. Population-wide averages. We know how most people metabolize a drug. Outliers get monitored more closely." Joren tilted its head. "You accept risk in exchange for speed." "Yeah," Joren said. "It's kind of our thing." A large screen on the wall flickered to life, showing a rotating 3D model of a molecular structure. It was overly complex, bristling with side chains and substitutions. Joren squinted. "That's not one of ours." "It is a derivative we synthesized from your amoxicillin compound," Eltrin said. "We call it AX-17. It appears to disrupt cell division in at least 9 known pathogens, including 2 we had previously considered endemic." Joren rubbed his forehead. "Are you modifying these without running full toxicity panels?" "We are using controlled simulations," Eltrin said, "based on extrapolated human pharmacokinetics." "You're assuming alien bodies process drugs like ours." Eltrin was silent for a moment. "We assumed the base compound would retain function." Joren sat up straighter. "You can't do that. You can't just tweak a molecule and drop it into a new biosystem. You could kill someone. We have protocols. You don't have ours." Joren snapped. "There's a reason we test on cell cultures, then animal models, then small-scale human trials. You can't jump straight to full deployment just because the simulation looked pretty." The room was quiet. Even the nutrient cube had stopped vibrating. Eltrin inclined its head. We did not anticipate such variability in metabolic response. You have to, Joren said. Every time, you can't shortcut this. The silence held a second longer, then Joren raised one armored arm. May we request human testing protocols? In full, Joren hesitated. You'll need clearance. But yeah, I can start the authorization chain. We would also request samples of your other antimicrobial agents, Joren added, and instructional material on resistance mitigation. Joren exhaled slowly. I'll make a list. By the time he left the observation chamber, it was well into the next cycle. The station's internal clock had dimmed the corridor lights to simulate night. He stepped into a transport pod that whisked him silently toward the medical wing, where he'd been reassigned temporary lodging. As he entered the small suite, the lights adjusted automatically, revealing a narrow cot, a sink, and a wall display playing a silent loop of ocean waves from some unknown world. He sat on the bed and pulled up the tablet he'd been issued. It took him over an hour to type the requested list: first-line antibiotics, dosing ranges, standard contraindications, known side effects. He flagged every entry with a red warning, for research only, not for clinical use without full testing. The next morning, he was summoned again, this time not by the diplomatic corps but by a civilian medical team. They met in a sterile chamber with no chairs and temperature controls, set several degrees too cold. The lead, a small spherical being named Taylor, projected a simulation onto the wall showing a complex bacterial structure being disrupted by AX-17. Your concerns were valid, Taylor said. We administered the compound only in vitro. The results were dramatic, good or bad, unclear. It sterilized the culture within 10 seconds, but it also disrupted adjacent tissue analogs. Yeah, Joren muttered. Sounds about right. We have suspended further trials. However, we have another question. He braced himself. Shoot. Your people discovered these antibiotics by accident. Is that correct? Kind of. Penicillin came from mold. Someone left a Petri dish out too long. The rest followed from there. Taylor blinked or did something close to it. So your most powerful medical tool originated from a mistake? Yep. Fascinating. The rest of the day blurred into a series of briefings. Not official ones, just curious scientists, medics, and engineers stopping him in corridors, asking about shelf stability, climate tolerance, biotransformation. One group had already started designing a universal delivery system that could adapt the pills into sprays, gels, or injectables depending on species. Late that evening, Joren found himself back in the infirmary, this time not as a patient but as a consultant. A young alien child had come in with an unknown infection fever, swelling, and respiratory distress. The staff had no idea what to use. He reviewed the scans. The infection looked bacterial, though nothing matched their usual pathogens. He suggested a low-dose cephalosporin analog, adjusted for body weight and metabolic rate, and insisted on hourly monitoring. By the 6th hour, the fever broke. Taylor approached him as he filled out the progress notes. I did not expect such broad efficacy, she said. Neither did we. That's why we monitor, she paused. Do your people fear the consequences of such power all the time, Joren said. That's why we don't get cocky about it, she nodded. You are not what I expected, Joren looked up. What did you expect? A species that conquered disease with precision weapons, not one that stumbled into victory through mold and caution. Yeah, Joren said with a tired grin. Welcome to humanity. When he finally returned to his quarters, the wall display had changed. This time it showed Earth's moon, slowly rotating in silence. He sat back, arm aching faintly under the sling, and watched it for a while. He wasn't sure if they understood what they'd found in that little white pill. Maybe they never would, but at least now they were asking the right questions. Joren's shoulder twinged as he adjusted the sling, stepping carefully into the surgical observation suite. The platform beneath his boots vibrated softly with the hum of inertial stabilizers, while overhead, A half-dome of translucent shielding separated the observers from the sterile theater below. On the table, not yet draped, lay a curled form, thin limbs, iridescent skin, and a dozen shallow incisions marked in light across its thorax. Dr. Valen motioned him forward. "You've reviewed the pathology?" "Yeah," Joren said, squinting at the display. "Looks like a systemic reaction to their own symbiotic bacteria. It's feeding on the host. This species regulates its microbiota through environmental exposure. Their immune system doesn't reject it, it manages it through chemical signaling. Something disrupted the balance." Joren lifted a brow. "And you think a human antibiotic can fix it?" Valen tapped the panel. A new image appeared, a slow-motion scan of the bacterial colonies inside the alien's tissue, replicating in erratic bursts and clustering near neural nodes. "We tested AX-17, no effect. But your doxycycline halted growth in 2 isolated samples. We've verified compatibility." "It's a broad-spectrum inhibitor," Joren said, "but it's usually bacteriostatic, not bactericidal. Are you sure that's what you want?" "The issue isn't elimination," Valen said. "It's control." Joren nodded slowly. "You'll need to taper it carefully. Too much and you'll crash their symbiote population. That could trigger a full cytokine collapse. We've prepared a microinfusion protocol. Gradual introduction titrated to neural feedback." From the left, Dralin emerged beside them. "We'll begin in 5 minutes. Observation only, but we'd appreciate your oversight." Joren didn't argue. He leaned forward, watching as the surgical team below moved into position. The Lade, a tentacled being wrapped in sterile mesh, inserted a thin catheter along the patient's spine. Another team member prepared the syringe-clear fluid drawn from a vial labeled in 3 languages, including English. "Doxycycline Hiclate, 100 mg/ml. The infusion began slowly. Joren's fingers tapped a rhythm on the console. "Watch the vitals at the 3rd minute. If the heart rate slows, it's working. If it spikes, shut it down." They watched. At minute 3, the monitor's pulse graph dipped just a little, then stabilized. No alarm, no erratic spikes. Valen exhaled. "Stabilizing, neural activity normalizing." Joren leaned back. "You lucked out." Dralin turned toward him. "Luck or your species' absurd pharmacological reach?" "I'm voting luck," Joren said. "That drug was meant for acne and tick-borne illness back home. Yet it rebalanced a collapsing alien microbiome," Valen said. "You understand how that sounds to us? Like we threw darts at a cosmic dartboard and hit something useful?" "Exactly." They left the observation suite. 20 minutes later, the patient stable and in post-op recovery. As Joren followed the 2 medics through the corridor, a maintenance drone zipped overhead, spraying a faint mist that smelled like citrus and iodine. He rubbed his eyes. "I need sleep before I start thinking all this is normal." "You'll have time," Valen said. "You're scheduled to speak in 3 hours." Joren stopped. "Speak? There's a medical symposium. You're the keynote." He stared. "I'm not a public speaker. I'm barely a functioning adult right now. You're the only human on the station with practical field experience and access to the full pharmacological database." Joren pointed at his sling. "I'm on medical leave." Dralin gestured toward a door. "You can sit." 3 hours later he sat. The auditorium was filled with beings of every shape and texture. Some sat. Others hovered. A few dangled from ceiling fixtures naturally. The lights dimmed, and a projection of Earth's molecular pharmacology tree appeared behind Joren's seat, a branching diagram of hundreds of compounds, each tagged with a date, a purpose, and a note on resistance. He didn't stand. He just cleared his throat. "I'm not a researcher," he began. "I didn't invent any of the stuff you've been studying. I didn't even understand half of it until I had to administer it. But I've watched it work in real time, and I've seen what happens when it stops working." The room was quiet. "Every compound we use," he continued, "was built from necessity. We didn't get them right the first try. Some of them killed more people than they saved. But we kept going, because we had to, because the alternative was worse. A being with a pulsing crest lifted a limb. And now you give them freely, Joren shook his head. No, I share knowledge. You still have to earn the understanding. If you skip the hard part, you'll repeat our mistakes. Another, with fur that rippled like grass in wind, asked, What if we improve on them? Then good, Joren said. But don't forget where they came from, not from brilliance. From desperation. Afterward, as the audience dispersed, a short creature with crystalline skin approached him. It held out a data slate. We've compiled your speech. It resonated. He glanced at the screen. You titled it, The Doctrine of Desperate Ingenuity. He rubbed the bridge of his nose. Sounds dramatic, appropriately so. Over the next 2 days, the medical wing changed again, not in structure but in tone. The energy shifted, less curiosity, more collaboration. Where before there had been whispers and observation, now there were side-by-side experiments. Human antibiotics weren't just being studied, they were being adapted, carefully, cautiously, under strict oversight. Joren walked the halls without a sling for the first time since the fracture. His range of motion was still limited, but the pain had dulled to a manageable throb. Dralin insisted on one last scan before discharge, and Joren agreed on the condition that it didn't involve any more lectures. The scan confirmed full alignment. Regrowth was on track. No infection. No complications. As Dralin signed off on the discharge, he looked up. You've shifted our entire pharmacological approach. Joren shrugged, then winced slightly. Didn't mean to. Just wanted to not die. Valen joined them, handing Joren a new medkit, sleek, silver, and stamped with both human and alien insignias. Mutual design, contains adaptable delivery systems, comes with multilingual warnings. Joren opened it. Inside were 3 blister packs, a foldable injector, and a small touchscreen linking to an evolving database of cross-species compatibility. He looked up. This won't fix everything. No, Valen said. But it's a start. As he prepared to board the departing shuttle, a small crowd gathered: medics, researchers, translators. Even the surgical lead from the observation suite appeared, offering a nod of acknowledgement. No speeches. No ceremony, just quiet thanks. Joren took one last look at the station. Somewhere behind its polished bulkheads, a dozen alien patients were recovering because of medicine invented by people who didn't know aliens existed. Medicine born from mold, trial, and sheer stubbornness. He stepped aboard, sat by the window, and let the shuttle lift free. No fanfare. No final words, just a man with a medkit full of improbable miracles heading home.